Hi, my name's Christine Jeske, and I will be doing this short video about the MIQ for the Life Career Assessment for Phase 2. Um, this assessment basically measures 20 different needs and corresponds that with work-related reinforcers, which is kind of like the environment in which um, like certain needs get fulfilled in the workforce, and it also um, corresponds with 6 values that could be important to clients who are looking for career advice or help. There's 2 different forms of the MIQ. There's a paired form and a rank form. Both forms are equivalent, so one is not necessarily any better than the other. The paired one is basically they have 2 statements, and the person chooses which statement is more important to them, and then it tells which reinforcer are more important than the others, but it also shows which ones are not important at all. Some have found that one is easier. It's easier for the test taker to choose between 2 statements rather than a whole bunch. And the average time for the paired form is about 35 minutes, but there's no real time limit. That's just the average time it takes normally. The rank order, or the rank order instrument form has the individual rank in order of 5 statements in each group according to their importance, up to the 20 needs. It requires less time, and it avoids seeming repetitive like the paired one does, but and the average time is about 20 minutes as opposed to the 35 for the paired. But for the rank order one, they'll be dealing with more than like this choice or this choice. There will be like up to 5 statements that they have to rank in order instead of just the 2 statements to deal with. Overall, the MIQ is a highly reliable and has really good validity. With adults, it is not recommended to be used with anybody under the age of 16 for sure, but they recommend adult usage. It can be administered in groups or through individual self-administered. It can be self-administered. There's no time limit. However, like I said, 20 to 35 minutes, or based on which form you use, is about average. And it requires minimal supervision. The scoring, once the forms are completed, then the computer can score them. There is a hand scoring option, but it's very time consuming. And then it gives you a print off profile for the clients based off of their answers. The one thing about the profile is the counselors need to look in the upper left-hand corner for the LCT score. If it is above 33% for the paired form or above 50% for the ranked form, that means that there's enough consistency in order for the counselor to interpret the scores. However, if it's below those 2 percentages, then the counselor should proceed with caution in interpretation, because that could happen through random responding for various reasons, whether the client isn't motivated or the client doesn't understand the question, or um, they just decide to randomly answer questions. Um, so just kind of be aware of that score before you interpret, see how accurate those scorings are. This assessment has many clinical uses. It can help stimulate thinking about vocational needs for the client. So if they're kind of on the cusp of what they want in a career and what they want, and they're not quite sure what they want or how much they want or which need is more important to them, this would help with that. It also clusters occupations, so if they know that there's a certain need that needs to be met, it can help cluster occupations that correspond with that need in order to get the client and the counselor to think about certain paths career-wise that would benefit. It also can be, it tells the client's most and least important need, the hierarchy of their needs, so which ones seem to be most important to the client. You can reference those needs to norms as well, which can help with careers, because you find out if the norms have many of these needs, businesses are more likely to have them. So it could help pair the client with that. And then it also helps with likelihood of satisfaction in specific occupations. So it can kind of help the client to predict whether or not they're going to feel satisfied in any particular occupation that they are thinking about entering. Of course, this is an assessment and based off of interpretation, and so it should not be fact. There's always a margin of error. But with the high reliability and the high validity, it can allow clients a good idea of what to expect based on what their needs are, paired with the occupations that correspond to those needs. Again, every individual is different. Every occupation is different. There's a lot of other factors that this does not take into consideration, such as coworkers, how that relationships with coworkers, that kind of environment, and other personal issues that the client might have within this whole career inquiry. But it's highly reliable, fairly quick, and very valid assessment to use for clients who are inquiring about a career change or career choice that they are thinking about. Thank you. Hope that helps.